Hi, my name is Quinn, and I'll be your nurse today.
Hi, Quinn.
How are you feeling?
Not so good.
Not so good. What's wrong?
Everything.
Oh my god, I'm so sorry. We'll have to assess her vital signs. So first what I would do is obtain the history, and we would look at the weight and height, but I can't measure the height because we don't have a tool here for that. And as for weight, we're not talking about it right now because the Victoria's Secret show is on, and
we already feel
not
that
feeling
about ourselves.
So, all right. Next, what I would do is wash my hands, and during that, I would sing "Happy Birthday" to myself twice, and that would be 30 seconds. And I would wash with antibacterial soap, and it's the pressure or the force that takes off all that bacteria. That would be bad. So I'm washing my hands for that amount of time. And what I'm going to do next is take her pulse, which you check it on the radial side. And you use 2 fingers, and you can press down and then slowly lift until you feel the pulse. And so what you're doing is you would check the pulse for 30 seconds and then multiply by 2. And normal pulse would be 60 to 100 beats per minute. So you check for 30 seconds, multiply by 2. And when you're checking the pulse, you look for rate. You want it to be normal rate that's just consistent. Rhythm, you don't want it to change beats at all. You just want it to be the same beat. Elasticity, you don't want it to be hard. It should be a bendy kind of artery. It should be flowing through. It shouldn't be hard. Also, force, you should feel it on a 1 to 3 scale. 2 would be normal. You should be able to feel it, not like bounding, but you should be able to feel it, and it shouldn't be weak or thready. Next, you would check your respirations, and with that, it should be 10 to 20 breaths per minute. So I would be checking her respirations without her knowing, but she knows. So I'm pretending to take the pulse and checking her respirations, and with that, I'm checking for symmetrical expansion. I'm making sure that her lungs are expanding equally and that she's not having forced breaths or not sitting in a position that is bad for breathing. You don't want to be in a tripod position with your elbows on your knees. And that's it for respirations. And next, what I'm going to do is take the blood pressure. And the blood pressure should be, the gold standard is 120/80. Luckily, Maddie does not have long sleeves, so
nope.
She's perfect.
Well, I'm perfect for many reasons.
So what you would do is the blood pressure cuff, the width should be 40% of the patient's arm circumference. And as Maddie is not a child, nor is she obese, we have a good blood pressure cuff for this. So you want the cuff to be 2 or 3 fingers above the artery, the brachial artery. And I hate doing this. And put this trusty thing on. Make your beak. And you use the diaphragm of the stethoscope, even though people say bell, but everybody uses diaphragm. You fit that snug under, and you push down to obliterate the brachial pulse. Nope, you don't do that yet, actually. You push down on the brachial pulse so you can hear it.
I'm sorry.
And what you want to do is you want to pump the... We're sorry. So sorry. Okay, what you want to do is you want to pump the cuff until you can't hear the pulse anymore, and then you want to pump 30 higher.
I'm trying to stop.
And we're not laughing, this is very serious, because Maddie is sick. Snug. Okay. So Maddie's pulse is also 110/70, which is really good because the gold standard is 120/80. And that means she's healthy and everything looks good so far. And we're done, and it's the best day ever. Yay!
stop.
Had stop. Come on.
Right there.